For more context on this, let's speak to Eric Feigl-Ding. He is an epidemiologist and he's a health economist and chair of Department of Public Health with New England Complex Systems Institute. He joins us from Washington, D.C. First up, thank you for joining us. Second, when millions of Americans are looking at skyrocketing premiums or losing their coverage entirely, is this still a healthcare system?
Yeah, I think that America has a sick care system, not really a healthcare system. We basically do patchwork whenever people get sick. And, in many places, emergency room is like the last line of resort for many people. And right now, Medicaid cuts all for the poor are coming. And with the ACA health insurance plans, the subsidies help keep it affordable. A lot of people are going to see 2, 3, 4, and sometimes 5x higher healthcare premiums next year because of the expiring healthcare subsidies at the end of this month. And 2026 is going to bring a world of pain when these healthcare subsidies expire. And right now, there's zero congressional action to restore them. In fact, if you remember, that's actually the reason the shutdown happened for so long.
Exactly, Eric. This is what I want to talk about because the Senate just shrugged at fixing soaring premiums, right? Is there any way this can be fixed?
Well, the Republican solution is to give people potentially dollars in their health savings account, but it doesn't actually do anything structural. And there's talks of just abandoning any kind of health insurance reform and just say, well, we're going to make your medications cheaper, but we're not going to solve health insurance. Right now, health insurance reform, as you remember from the first Trump administration, was always 2 weeks away. We're always 2 weeks away from a solution, and we've never actually solved anything during that time. So I think though America is going to enter a world of hurt come January 1st. And a lot of people will simply not have health insurance. I think we're talking about 5, 10, 15% of the population just completely giving up on any health insurance.
Yes, Eric. And do you believe that Obamacare or ACA can realistically keep people afloat in 2026?
I think Obamacare, although it does need some reform over time, I think it is critical to keep the poorest Americans, because the subsidies is for working and poor Americans to afford health insurance. It's on a sliding scale. And without that subsidy of 75, 50, 75, 80, 90%, people basically, that's where the sticker shock is going to come. And without this assistance, Obamacare, it's like insurance. You need healthy people and sick people to hold it together. If only the sick people pay, then any insurance, whether it's car insurance or any insurance, collapses. And I think this is the problem where if a lot of healthy people say, you know what, it's too expensive, I'm not going to do it, and only the desperate sick people stay on it, then that's the collapse of health insurance as it is. So the subsidies are critical to keep everyone in the pool. And without the subsidies, a lot of millions, we're talking about 25 million people who are relying on these subsidies, millions of them will drop out of the system, and literally the emergency room will be their healthcare system.
And Eric, I'd like to get your take on this because as Capitol Hill continues to argue, right here, right now, what's the biggest public health risk Americans are facing?
Well, that's a very long list. We have RFK Jr. running the health department.
The biggest.
And, so I think anti-vaccine is one of the biggest issues that's like looming because American, measles outbreaks and many other outbreaks are going to surge in the coming years. But also the lack of affordability, not just in terms of everyday things. Healthcare especially is one of the largest things. And lack of affordability means America, half of all bankruptcies in America, maybe 2/3 soon enough, half of all bankruptcies are due to medical costs. And if that's driving bankruptcies and economic collapse, this healthcare crisis, if we don't solve it, 2026 will see the collapse of the entire health insurance marketplace. And with the collapse of also Medicaid, because of the slashes in the big beautiful bill, Medicaid also will be slashed from millions of Americans. I think the bottom is falling out of America, and people have not woken up to that reality coming next year.
Eric Feigl-Ding, Thank you for your insights.